Is there a motion to approve the minutes of the previous meeting, please?
I make a motion to approve them.
Second.
I guess at this point, we'll turn this right over to Ashley.
All right. So I have a brief little one-page synopsis of our current situation here in New York State and Lewis County, as well as some high points of what we're doing at Public Health in response to COVID-19. So once you get one of these, you can see the current case count for today for New York State, 1,374. We are up to...
Any sleep lately?
I'm fitting sleep in, yes. We're up to 12 deaths in the state. We have 19 individuals in Lewis County who are on precautionary quarantine. And I'll go into what that means in a minute. We have tested a total of 8 individuals, and we have 4 negative results that are back and 4 pending. So that is no positive COVID-19 here in Lewis County today.
Of the 19, are you including these 8? Or is that
Yes.
19? Okay.
Yep.
So it's
Yep. So if they've been tested,
11 that haven't been tested then. 11 have not.
been tested, so they have some kind of travel history that would put them, they travel
To
to
Iran.
yes, or China, or Europe. So those are individuals that we are currently quarantining at home.
Who's checking on them? Do you call them or?
So we do it however they prefer. So any individual under precautionary quarantine, meaning they are not positive for COVID-19, we are either texting or calling, whichever they prefer. So we are checking on their temperature and symptoms and gathering that data and reporting that back to the state on a daily basis.
How are you getting their temperature? They're taking it themselves then.
They're taking it themselves, yes. If they do not have a thermometer, we are providing them with a thermometer. Yes. So we are also ensuring that their basic needs are being met, so that they have food, anything that's going to make their time in quarantine easier for them to do. 14 days confined to a bedroom and a bathroom, that space can be, if they live with other people, can be difficult. So we check in, we make sure that their mental well-being is still good and they don't need anything else.
I got a question.
Okay.
I don't quite understand that one. A bedroom and a bathroom. Are they in a their own home?
They're in their
right?
own home, yes.
So
However,
if one individual in the home at quarantine, they're in their bedroom and bathroom, and they don't come out.
right now, with the rest, if
The
there's
rest of
other
them are in
people,
quarantine.
no. It's only that one individual that has a travel history that would be at risk. The rest of the home is not at risk. We are also testing individuals in their home who meet testing criteria.
What is that? What is the criteria?
So there's 5 different criteria. So an individual who has travel history and is symptomatic, those are the individuals that we are testing. Those individuals that are symptomatic and they have been tested for other viruses and those viruses have been ruled out. Those who have had contact with a lab-confirmed COVID-19 patient, and any individual who the provider working with the local and state health department feel should be tested.
And what would the symptoms be that you said that they're displaying symptoms?
Cough, fever, shortness of breath.
That's the basic.
Those are the most common symptoms with this virus.
So what is the threshold to be considered fever?
Above 100.
Above 100.
100 above. We are doing a lot of public education for infection control, social distancing, and then our local response to any of the new guidance from the governor. So making sure that people know how we're responding locally when the new guidance from the governor is coming out on a day-to-day basis. We are also doing our best to provide the businesses with education on cleaning and disinfection, screening employees. We're also providing clarification on guidance from the governor to these businesses. So we've had a lot of questions. We've pushed information out and then also received a lot of questions asking for clarification. So we're doing our best to provide them with written guidance so they have it to reference back no matter who's in the office, and just fielding those questions on a day-by-day basis. I will tell you, today has been one of the slower days in regard to that. So, and we just this morning made a plan for training incoming temporary staff. So right now, with the current staff and rearranging duties, we're no longer providing the early intervention or preschool services at this point. They are considered non-essential, so those staff have been assigned to other duties. We are maintaining and keeping up with the workload. However, we know when we have a case, that workload will grow exponentially. So we created a training plan to train individuals before that happens. So not necessarily that we're bringing them on and they're going to start work today, because I don't have work for them to do. But I want to train them at a time where we have the time to commit to making them feel comfortable. And so we're planning for when we have a positive case, each case needs an investigation. Part of that is going down through and from the time they were symptomatic, seeing who they had contact with and where they were, following up and finding all of the potential contacts, and then quarantining them. So that is where we are currently at. Do you guys have questions?
Is there a lead or the normal time to get results back from the test?
Yeah.
So it's been 36 to 48 hours.
You have more than one lab to do that work with now, right?
Yes. So we have Wadsworth, who we would be sending expedited tests to. Anybody who is a healthcare worker, elderly, or with underlying health conditions, those are expedited.
They go to
They go to
that lab
Wadsworth.
because they have a more rapid test.
No, it's not a more rapid test, but instead of waiting for send out to LabCorp, they are transported by state police down to the lab, and they're prioritized in the batch that they're put in at the lab.
Is there such a thing as I guess a suspicious test and they confirm it and it takes like another day or two to confirm that it's positive?
So we haven't had that situation, but I have not heard that from my other counterparts in the state.
It either comes back
It's either a
negative?
positive or a negative.
Okay.
They are getting closer though to a treatment. I understand from watching the news, or labs that are working on treatment.
They're
for
working
this.
on it.
There was a phase 1 test in Seattle
Yeah.
that they've given
Yeah.
50 individuals or something like that.
They treated them?
Yeah,
The
treatment.
vaccine.
A vaccine.
For
40
for
people were
treatment.
inoculated with a vaccine as a test.
Okay,
And guinea
Human
pig.
tests.
okay.
Now there is a coronavirus vaccine for cattle. I don't know if you've ever.
Interesting.
Right.
There is. I mean, it's on the label, coronavirus. It's basically the cattle get scours from the coronavirus. But I mean, I don't know. I don't understand why it seems to be such a difficult thing to modify to human.
Well, It's a very long process to make a vaccine, and then the testing piece of it
Yeah, the
is what's
testing is where it
even
is.
longer. And I personally would like a vaccine that's been tested and proven safe before I inject people with it.
Makes sense.
Ashley, with regards to the precautionary quarantines, who monitors that? These people monitor themselves, like in a house, there's a family of 7 people there, and one person's supposed to be quarantined. We're just taking their word for that?
So, yes, we are taking their word. Under a mandatory quarantine, we're required to go out and actually lay eyes on them and make sure they are abiding by the rules. If we have reason to believe that an individual who's under precautionary quarantine is not following the rules, we would follow up with that person, and we could potentially go to the mandatory health order. Still, if they're not following the rules, we can go to a court order. So we have processes in place if we believe individuals are not following that. We try to do as much education as we can in regard to the severity of this and the necessity to abide by the rules, but we can only do as much as we can.
Here's some interesting numbers from a spreadsheet that we were just sent around. The world mortality rate is 4%. The Chinese mortality rate was 4%. U.S. so far is 1.8%. And in New York, it's 0.0087, less than 1%. That may change as time goes on, but it's interesting to see that the mortality in the U.S. is running less than half of what it has globally. So that speaks for our healthcare system.
Yes,
I would say.
absolutely.
Okay, a couple updates from my perspective. The state has allocated emergency funds, not much, but $67,490 will be available to Ashley's department for this epidemic.
How much is great?
Well, for now, 67,000. And then I wanted to survey you guys. Things have been happening quite quickly, as Ashley said. Today's been quiet, but that was not the case Friday, Saturday, Sunday, Monday. I've been doing a daily email to the board. We could also set up a daily conference call. What do you guys prefer?
Emails are fine.
Emails are fine.
Okay.
I like to text on the phone. I don't sit there and go on my computer all the time, and I don't have my email on my phone. And I have 2 emails, and I don't want the other one on my phone.
Well, I'll only do one a day. That's the official, daily up. You might get buzzed here and there with some things, but I'll try to at the end of the day hit you with all the new stuff. So.
You would be home at that point. You could check up on email.
Oh, yeah, there's something.
NISAC has started a daily, so we have 3 daily phone calls happening already. So I'm happy to just do it. Yeah, it's good. So,
Do you see any more restrictions coming down the road with regards to the community not being, I'm just concerned about all our small businesses that are going to take a nasty shot with this.
I agree with you, and I completely understand that. There's nothing official, but I would be thinking we could go to only essential services, meaning pharmacies, grocery stores, gas stations, like other parts of the country.
The state has made some funds available for small businesses. The details aren't out yet, but they'll be forthcoming. 3.5% interest rate for small business loans and 2.75% interest rates for not-for-profits. So there'll be more details coming on that.
I bet it went lower yesterday afternoon.
I think the Fed rate did, but
That's what I mean, the Fed
the
rate.
state is, these are small business loans to, who knows what the shape of the business was in before this happened, so.
Brian, do you have any official directive on the public gatherings? I know there was one after the 500, but was there anything after the 50? Because all I read was a tweet. I don't know.
It's 50 in New York State right now. The president advised don't gather under 10, but that was not an official policy. It was just
Over 10.
advised.
So it's the same parameters as the 500 gatherings then, but now the number's reduced to 50 or what?
I think it's just 50. I don't think there's before it was under 500, and then if you have a venue like this room, for example, the occupancy in this room is 75, you had to cut that in half. Now it's just no gatherings of more than 50 people.
Okay.
Did I get that right? Mostly, actually.
Thank you.
Sure.
New York State Freeway, the other night, there's signs already up saying, do not travel, stop the spread of the virus. Anybody aware or hearing anything about them possibly shutting down the interstates between Connecticut, New Jersey, and New York State? If anybody heard anything about that? There are signs out there telling you to stay home and not travel, just so you're aware of that now.
Okay. One thing the governor has says he wants counties to keep their policies consistent, so it doesn't make sense for Lewis County to go under curfew because everyone's just going to go to Jefferson County. So, we really need to, there's some things should be statewide. And so the governor has told reiterated to the counties and cities, don't do your own rules, wait for it to be a statewide directive, which I guess makes some sense.
Brian, are we having any interaction with the towns and villages at all as far as the information we're getting? Is that getting passed down to them?
No, the first thing yesterday that we should have or need to follow up with villages would be the workforce, executive order on cutting the workforce in half. Ian and I talked briefly about it yesterday. I haven't had a chance to get an advisement out to the towns and villages, but I think some of their attorneys are reaching out to them, but we probably should, as the county, the big brother in the community, send them a little nudge and say, here's what's happening.
Actually, I forwarded that to our supervisor.
Okay, good.
Yeah, I did too. I just wanted to, I was asking for forgiveness. I said after the fact.
Okay.
Ryan, I think the one you, oh, I'm sorry.
But it would be better to come from you.
Yeah.
We had a few reach out with questions in regard to what is essential and non-essential, and we provided them a guidance in regard to that.
You got that too?
Well, no.
It's not official guidance, so
Right.
it's up to the locality
Yeah.
of what
Please
is
cooperate,
essential
guys. Yeah.
and non-essential. So,
Well, we're telling our clients, and I think what we discussed, generally you're looking at the highway crews.
Yeah.
That's the only non-essential service, but it gets bumped up to essential depending on the weather, correct, Ryan?
Oh, yeah, absolutely. We're running our highway crew. We've got roughly 30 guys over there. We're running 15 on, 15 off. So 15 one day, 15 the next. I mean, that's how you get to 50. What's that?
They're going by weeks, so they
Weeks,
have
okay, so week on, week off, that's how we're getting to 50%, there, but technically, we're not at 50%, we never will be, because every single employee at the hospital is a county employee, so we're not following the state directive, but there's no punishment either. There's a big discussion, I was just on the phone with NISAC, okay, if we're not, all counties they're following the directive in good faith, but there's no punishment or enforcement if we're at 53% and not 50, you know what I mean? So, Bob?
So, I did get a call yesterday from the Highway Superintendents Association
Okay,
with
good.
regards to this. And I advised them just to look at it from the 10,000 foot view for your towns and villages and communities, because you have to you'd have to half your staff. So I said, consider using your elected officials, such as your board members, etc., and count them as half your staff as well. Because some of these towns and villages are surviving on 12 people running the whole village. And there's 2 guys for the highway department. How do you take away one of those guys?
So we did that.
So I said, just look at this whole thing globally. Additionally, the state, I was in a highway traffic committee meeting earlier, and the state has actually, they've got to follow the same directives. What they did is they put their guys on for 8 hours in the morning, 8 hours at night, so they split their shifts so that they're not completely together. So by doing that, they're conforming to what they're being requested to do.
Yeah, the state's, of course, the state's executive direct, the actual order didn't come out until this morning, but that's pretty standard. Something is announced, everybody reacts, then we get clarification, but regardless, I sent a directive to all of our staff today, all of our department heads that said, everybody that's home is still being paid by the taxpayers. They still need to find something to do to contribute to, what's happening. So if there's a project you've been putting off, something you wanted researched, or, 50-year-old files that need to be organized, send them home. Try to keep people contributing in one way or another. So we're gonna do our best on that front, but it's not gonna be as productive as if they were here, obviously. So it is what it is.
We've started getting guidance from local municipalities throughout the afternoon on what they're implementing for the 50% reduction. So
There's been a lot.
it is starting to get out there.
Good.
Well, there's a couple other things, but I guess we could save it for finance and rules because there's some things happening in Albany with the budget, and you guys need to be updated on that as well. So.
Any more questions for Ashley?
Thanks for all your work.
Thank you.
Thank you very much.
Ashley.
Are you still glad you took your job?
This is what we live for.
Jerry's here too if you have any questions about that.
Jerry, do you have anything to add from a hospital perspective?
Right before I came down today, I sent another update. I've included Ryan and Larry and Ashley in my distribution, and I know Ryan has been forwarding those notes to the entire board. So on a daily basis, you see what we're doing. Tomorrow, it'll be more restrictive coming into the acute side of the campus. And this is an example of when we screen. You see this band. This means I passed the temperature test and I'm well, and now I have access to the campus. So this is how you manage hundreds of people coming through a limited gateway into your campus. So that's how we do it. It's not high tech, but it's one of those times where high tech doesn't always work best. You gotta be practical and functional. So working through that, but we are already focusing on, we have to transition now from preparedness for the virus to also providing basic health services. And many of our activities have been shortened or curtailed or have been postponed. So we're going to begin the conversation now of living in a world with a virus, but also at the same time providing services. The labs, the images, the surgeries, the wellness visits to the doctor's office. So we now have to begin focusing to creating normalcy in the organization. And we have some financial responsibilities, and our financial responsibilities are met through billable services. So we also now have to start thinking about that. The other thing that we're thinking a lot about is surge capacity. If we were to get overwhelmed, what would we do? Almost by definition, a critical access hospital gave up its surge capacity when it became a critical access hospital, right? That was an effort to save rural healthcare by limiting size. So we're going to go through a process. If we needed to add beds, where would we add those beds, and how would we add those beds? It's really not an immediate issue for those of us in the North Country. It's more of an issue for those in the greater New York metropolitan district, where the vast majority of the cases are. And the growth of the virus is tenfold. That's not happening up our way. So I think part of our process is to be organized and disciplined and science-driven. So that's what we're doing on our end at this point.
You possibly touch base with Fort Drum if you needed, if you got an influx where you could the numbers. Could they set up a MASH hospital?
We have, the way we work with Fort Drum is through the Fort Drum Regional Health Planning Organization. Are you familiar with that group? They, all of the hospitals in the North Country region are part of that organization. And so I sit on the board representing our community hospital, as well as, Carthage and Samaritan. I would see that being the group where we would work with them, so we're not replicating something 6 times. But we have not gotten to that place yet.
Anything more on critical access?
No, not specifically. The request has gone in to delay the recertification process, which I believe that will happen. So we'll kick the can down the road, which is fine, because I think ultimately we'll prevail. What it does mean is we're probably at that juncture where our capital project will be put off into the next building season. And that's just because the CON process won't be there for us. We still haven't heard on Copenhagen yet. And as CON projects go, that is a very simple, small project. But you can understand, right, the state resources are being refocused elsewhere. So we're going to continue with the design. We will probably go out there and try to bid the project. We have to work through some permitting processes, and we have to go through something called C-Corps. So we're going to still move forward. So the minute all of this is past us, we can hit the button and electronically submit the CON.
Jerry, question, are you using for the temperatures, the electronic scan devices that you're using for the...
Yeah, we're using EO.
Is that something that would be possible that could be supplied? Like you say, if you're controlling a situation coming out of that many people, the Sheriff's Office and Social Services both have a tremendous amount of employees there. Is that something that could be taught and shared with us so we could do the same thing if need be?
Oh yeah, and it's very easy. They taught me and I mastered it in one try.
So we could come to you possibly to see that, so it would help us.
Yeah, why don't you reach out directly and we can set up the education.
Thank you, sir.
Yeah.
I have a question. Crystal, how are we with the home delivered meals replacing congregate sites?
Yeah, we're doing great. So we've added 47 people to home delivered meals, about half of which were people that were going to the congregate sites. The other half have just been new community referrals. So we're continuing to make phone calls to folks who we sort of prioritize the congregate meal list and called those that my staff knew were most vulnerable first. And we're meeting with Fred McManus this afternoon to talk about implementing some plans that other communities have put into place, to talk with him about capacity for food production moving forward, perhaps altering how we deliver meals to serve the whole community for the duration.
Very good, thank you.
One thing I think you all should know too is that Jenny and I have worked together with local school districts to put together a plan for us to all work together. So if there's a need that someone has in the community, they're following directions, isolating at home as a precaution, they can call the Department of Social Services, express their need to us, whether it's food or prescription pickup. If that person has the ability to meet their own need, we're assigning it to a volunteer from the school district. And if they need our office's services, we're expediting meeting that need.
Thank you, Crystal.
Have you thought about possibly utilizing public transportation system? Because I mean, they are stopped, like at the senior Steeple View, I know they stop there daily. So,
Yeah, so that's some of the contingency planning that we're working on now. What if our current drivers aren't able to deliver? We have county employees that we could utilize. We have the public transportation system. I'm just working with my team to stay as organized as possible around the routes so that if and when we have to start something new, we can.
Well, I know the public transportation hits those sites,
Yep.
each and every one of them. So for the senior end of it, those are the people we're concerned with, I believe.
Definitely. We want to support
We'd
people.
rather
to stay
have them
home.
stay home,
Exactly.
not die.
Thank you, Crystal. guys are doing a great job. Appreciate it. Okay, ma'am.
Resolution to authorize an agreement between the County of Lewis binding through the Lewis County Community Services Department with Coordinated Care Services to receive provider support training for employees at the Lewis County Community Services Department, Lewis County Treasurer's Department, and contract agency fiscal staff for 3 sessions at a cost not to exceed $4,380.
Any discussion? All in favor?
Yeah.
Opposed?
Resolution to appropriate $130,975.08 in the community services accounts for the Healing Community Study.
Discussion?
I have a question.
Sure.
This is you, Pat, right?
Yes, yeah.
Well, what is this healing community study?
That's the Columbia University study
Okay.
in regards to reducing opioid deaths by 40% by implementing some certain strategies within our county. We're one of 16 New York State counties.
Uh-huh.
Is this budgeted money?
So
This is
No,
a
it's a grant.
grant.
this is a
Oh,
Oh,
okay, this is
grant money.
receiving.
Right.
it.
This
we're
is-
receiving it,
It
yes.
said appropriate, it didn't say who's.
No, this is a budget appropriation to recognize the revenue from the grant and the potential, or the expenses through Pat's department to fill the grant.
This is the program we've been working with Columbia University. We've got the ability to add a couple employees that we're working through FDR HPO. They're gonna, give us some case management and some other techniques to help reduce drug use and opioid deaths.
Probably it would have been less questionable if they put grant money.
I think okay.
You know what I
Yeah,
mean?
I do, yeah.
Thanks, Pat.
Thank you.
Any more discussion? All in favor? Aye.
Aye.
Opposed? Carried.
Resolution calling on members of the New York State Legislature to reject the governor's 2020-21 executive budget proposal to shift 100% of the cost of Mental Health Law 730.220 competency restoration services to the county, which will cripple county budgets and have a devastating impact on the county's ability to pay for behavioral health programs.
Discussion?
Paper for their shredders.
So right now, the cost is split with the state and the jurisdiction with which the county, the test is happening. So these are the tests that we give to see if somebody's competent for trial. And it was traditionally split with the state because a lot of times these people are in state facilities while they're awaiting trial. Sometimes the crime was committed in Jefferson County, but the trial's here, so it was hard for counties to reconcile the costs. So the state just handled half, we handled the other half. Well, the governor's proposed budget has 100% of the cost now going to counties. And if my memory is correct, it was about, what was the number, Pat? 80,000 last year for us, it would have been? Or was it 8,000?
8,000.
8,000.
It was for, that's for one evaluation.
Right, and we typically do two or
Yeah.
three.
$8,000 to
Yeah.
figure out whether they're competent?
I don't know.
It's more than just the test, it's for their.
And then they have to testify and everything.
No, but also then if they determine that they're not mentally competent to stand trial, and they could be in their place, this is part of the expense that we pay.
Correct. And on average, they set the rate, and on average, one day is $1,200. And right now, we would get paid half, and the other half would get paid by somebody else. So they're asking us to cover the whole amount. The other problem with this is we have, as a county, or as my department, has absolutely no input or monitor, or way to monitor how this person is doing within the state system. So we just had to get the bill.
So they're sent over to top.
Budget as a law, is that what you're doing?
Yes,
Can you
he's
explain that?
changing. Yes, he's changing the 730 evaluation law through the budget. Yes.
So it would be a law if he passes it then.
Oh yeah, a lot of the things they do are From the
the
budget,
law.
they do.
Yeah, I just wondered, if that's what we're, yeah, the law.
So that would be like a facility over at Tupper Lake?
No, it'd be like Marcy, there's a facility, there's a state, any facility that's considered a state forensic unit. The closest one we have is Marcy, Hutchings, there's one in Rochester. And actually the daily rates kind of vary a little bit, but on average it's $1,200 a day. And your average length of stay is like a minimum of 6 months. And in some cases, they're there for 2 years.
I think, and another important thing to point out is the county doesn't have any say over how quickly these trials move and how many motions there are and how it gets delayed, and people can stay in these facilities for a long time. And the state has always had some responsibility since they own the court system. They're the ones, that have some responsibility if somebody sits there for, a year and a half. But now it will be 100% on us if this passes.
I make the motion. Oh, we don't do a motion.
Great. Just don't fit.
Any further discussion? All in favor? Opposed? Carried.
Resolution to authorize an agreement between the County of Lewis by and through the Lewis County Office for the Aging with Lewis County Health System for them to provide adult day health care services to respite OFA clients at a daily rate of $249.96 for an approximate 5-hour day for a term of January 1st, 2020 through December 31st, 2020. The daily rate, including round-trip transportation, is $390.28, and transportation one way is $327.79.
None of these numbers make sense to me. Can someone explain that to me?
So the $249.96 a day, that is if the client transports himself to the program at the hospital. The $390.28 is if they have transportation from their home to the hospital and then back home when the program's complete. And then there's the $327 is just one-way transportation. We would encourage clients, hopefully, to transport themselves to the hospital.
So who's transporting?
The hospital provides that transportation for these participants.
Either a little bus.
And this would be funded through our existing grant with the Alzheimer's Association for respite care for caregivers.
This is totally in hospital, not in home.
Right.
Right.
Right. And this would be for not many participants each year. You would use this rarely unpredicted.
It's the medical day program at Lewis County General Hospital.
And is the focus on Alzheimer's? Is that what you just said?
Yes, the funding that we would be utilizing is from the Alzheimer's Association to provide respite for caregivers. So the person with Alzheimer's would go to the adult day program for the day so that their caregiver could have free time as respite.
Is there a limit on how often that can happen?
There is. That's 120 hours per caregiver per year.
Thank you.
So currently you don't have very many participating in this?
We meet the need in other ways right now through aids through US Care at home. We provide the respite services at home. This is another option that I'd like to be able to provide for families if needed. And we would use it for only the most at need folks.
We've been talking about the aid shortage, right?
Right.
Time and time again, we talk about how we can't get aides to go into the homes.
Right.
Well, if we have this option available,
It's
we
something,
can,
right.
it's something that will help.
The service is covered under Medicaid managed care and Medicaid
So the people involved wouldn't have any out-of-pocket costs?
No.
Unless they drove them down? So,
Right.
Okay. Thank you. Glad to hear it.
Thank you. Any further discussion?
Have you considered checking to see if it would be more cost effective for a different transportation other than the hospital's transportation? I mean, it seems like, you know, you're looking at one way, it's not quite $80.
Transportation's built into the day rate of the hospital and $7.
No, that's not what I'm asking. I'm asking if you've looked at another transportation mode, you know, like a different
Yeah,
different
we
person transporting.
are actually working on an agreement with the Volunteer Transportation Center to be able to bill Office for the Aging directly for non-trips that are not doctor's appointments. So Joan and I are working on that. And yeah, I hadn't thought of that, but we could utilize that as an option.
I mean, a round trip, that's, you know, quite a bit of money, really. I mean, how far are you transporting them?
All depends where they live.
I mean,
My understanding is the hospital doesn't have flexibility around these rates. The rates are set by Medicaid rates, right? Yeah.
Yeah,
And
you know,
just-
you've got to understand that whether we're picking up in Lowville or the furthest end point in the county, it's a fixed rate, and that's predetermined for us. So
By-
that's you know,
predetermined by who?
the state. We're getting
Dictates,
the rate.
dictates how much you can charge.
No, in this case, this is actually a pretty good rate for what's being delivered. The only other option would be to go to a rate based on mileage, which, if you live close to the hospital, that would be advantageous for you. But most of our folks live further away from the hospital. So this blended rate actually is probably the fairest approach.
And it's probably wheelchair capable.
Yeah.
and-
Yeah, that's a good point.
The 5 hours is in hospital time,
Yes.
so the travel time is not included in the 5 hours.
That's on top of, because you gotta get there and then come
Right.
back.
Okay.
Everybody good?
Yep.
All in favor?
Aye.
Aye.
Opposed? Carried.
Resolution to authorize the agreement between the County of Lewis by and through the Lewis County Office for the Aging with Northern New York Senior Services, DBA Seniors Helping Seniors, to provide housekeeping / chore and/or respite services to designated elderly residents in Lewis County that are homebound, ill, or disabled, and who have been accepted into care by OFA at a cost not to exceed $23.50 per hour for the term January 1st, 2020 through December 31st, 2020.
Discussion? All in favor?
Yep.
Aye.
Carried.
Resolution to approve the contract between the County of Lewis by and through the Lewis County Department of Social Services with Liberty Translations and Interpreters, LLC, to provide trained on-site interpreter services, telephonic and translation services to the Lewis County Department of Social Services for the period of March 1st, 2020 through March 2nd, 2021 at the following rates. Spoken language pre-booked is $50 per hour. Spoken language same day is $60 per hour. Client no-show or cancellation without 24 hours notice for spoken language is $50 per hour. Telephonic, $1.50 per minute, and telephonic cancellation, $1.50 per minute. Additionally, if LTI travels more than 15 miles from the nearest LTI location or 30 miles round trip, there is a mileage charge of 58 cents per mile. The local share is 25%, federal share is 50%, and state share is 25%.
Discussion?
How far away is LTI? What's the
They have
mile?
offices in Utica and Syracuse.
I assume this is mandated.
We have to have interpreter services. This, we had Miami in the past, and that interpreter service is closed down. This is a HIPAA compliant interpreter service that we can also use in court. So, we use them primarily in our CPS world. That's why the same day. If they're in the office, we just use the language line. If it's like a snapping
Resolution to authorize a modification agreement to the memorandum of understanding between the County of Lewis by and through the Lewis County Department of Social Services and New York State Office of Children and Family Services for the purpose of registration and inspection of child daycare providers for the term of January 1st, 2020 through December 31st, 2020. The Lewis County Department of Social Services shall receive $8,400 quarterly, maximum funding amount of $33,600, for an acceptable level of compliance and performance as specified by the Division of Child Care Services for registration and inspection of child care providers.
Any discussion? All in favor?
Aye.
Carried.
Resolution to authorize an agreement between the County of Lewis by and through the Department of Social Services and the Community Action Planning Council of Jefferson County for the purpose of conducting registration and inspection of family, daycare, and school-aged children care providers in Lewis County for the term of January 1st, 2020 through December 31st, 2020 at a cost not to exceed $31,920 payable in quarterly installments of $7,980 upon receipt of a completed quarterly registration review report from the DCCS regional office. The cost of these services are 100% federally funded with no local share cost.
Any discussion? All in favor?
Aye.
Carried.
Resolution to transfer $1,124.11 in the social services accounts to reallocate funds for WIOA.
Discussion? All in favor?
Aye.
Carried.
Resolution to authorize the Lewis County Commissioner of Social Services to move funds within the WIOA budget lines provided that said amounts do not exceed the overall annual WIOA budget allocation to Lewis County and provided that the Commissioner advises the Treasurer of the amounts and the WIOA accounts reallocated.
Discussion? All in favor?
Aye.
Opposed? Carried.
Resolution to appropriate funds in the social services accounts for the purchase of various computer equipment in the amount of $20,049.90 with funding coming from Project HAE Capital Equipment with a balance of $93,918.94.
Discussion?
Jenny, this seems kind of high for computer equipment. It's 20 grand?
That's just the local share cost.
The total cost
That
is
is
less.
buying computers that are now Windows 10 compliant for the entirety of the DSS staff.
Oh, so you're updating all your computers to Windows 10? Is that required?
Well, Windows 7 is no longer supported. Yes.
Okay.
It was in our capital budget as well.
Any further discussion? All in favor? All in favor? Aye. Okay, you're all set?
Yep.
Okay. Passed.
That is all I have.
I know, I'm overdue.
You're over.
Any more from our department heads while they're still in the room? Meeting stands adjourned. Thank you very much.
Actually. Greg Sucker. She's a good driver and she much to my chagrin.
So I've been so much figuring throughout this whole thing. I'm not prepared to give them final.
What's that?
Water?
What's that? Yeah, I guess so.
I
gotta get on there.
That's where my name goes. I just don't want to be around anybody